And we really feel as the State Department of Health that this conference has a huge potential to drive change, both from a training perspective as well as from an acceptance perspective of families.
When I talk to my patients and their families and how we've been able to help them with their lives, I find that they will tell me it's incredibly empowering and helps them to live their life better. So what I wish people would know is that palliative care is actually a wonderful thing for people to be able to live their lives. It's not scary. It's incredibly helpful, and I think the amount of support that it gives, not just to the people diagnosed with the illness or injury, but also the families, is incredible. I came across just a really kind, amazing couple. The patient was the wife, and she had a pretty difficult diagnosis to cope with, a brain tumor. And these are intelligent, articulate people who knew what was coming and were trying to navigate healthcare system. Imagine being whitewater rafting without a paddle. That's what I think it felt like for them.
My wife and I, Rosalie and I, spoke of the palliative care being one of the most intimate moments in our 40 years of marriage, because it was really the point that helped us have the discussions that she should have toward the end of life. What we really thought and viewed it as, palliative care is, we're in a vehicle approaching an intersection, and we have our left turn signal on, and we just begin to make the turn. And all the while that we're turning left is palliative care. When we complete the left-hand turn and are now through the intersection, that's when we were going to go into hospice. And so we knew there was an interim period between hospice and where we were at the beginning when she was diagnosed. And palliative care was all in the middle.
Palliative care really should be available across the spectrum of care, and we think often about palliative care when we think about things like hospice, and we really want to expand access beyond just hospice, to think about this as a skill set that improves the lives of patients, of their families, and ultimately of communities.
So join me and the incredible group of speakers and individuals we have that are both planning and attending this conference on September 27th. This is our first state palliative care conference, and I know you are going to come out of it feeling energized to advance this specialty.